Welcome to week 5 on multicultural competence or multiculturalism. There are some special materials to read for this week. Be sure to find them in the modules under videos and reading, and also under the files menu under required reading. Assignment number 2 will be due March 17th and cover these topics. Color blindness. The definition of color blindness is racial ideology that posits the best way to end discrimination is by treating individuals as equally as possible, without regard to race, culture, or ethnicity. However, color blindness creates a society that denies their negative racial experiences, rejects their cultural heritage, and invalidates their unique perspectives. An alternative to color blindness is multiculturalism, an ideology that acknowledges, highlights, and celebrates ethno-racial differences. Moving from color blindness to multiculturalism is a process of change, and change is never easy. Multicultural competence is the effectiveness in interacting with people who are different from you. It is the ability to have positive, productive, and enriching experience with people from different backgrounds. Areas of multicultural competence includes first, that the counselor is aware of their own cultural values and biases. Then gain an understanding of the client's worldview. And then lastly, to develop culturally appropriate intervention strategies and techniques. So we are going to start with exploring our own cultural values. One way to increase your self-awareness is to know how you react in multicultural situations. How do you think, feel, and behave in situations with people who are different from you? Our natural human response to a situation that is unfamiliar is to interpret this as a potential threat. This activates the freeze, flee, fight, or fright response. There are ways to increase our knowledge about our own group or culture. By doing this, it provides a springboard for learning about other groups. Knowing yourself gives you the confidence to go out and learn about others who are different from you. And some of the ways that we may discover our own group is, for example, to talk about with our own family members about our own culture and traditions. Perhaps doing a family tree and understanding the culture that has developed throughout the generations. You might take classes on your own group, read books, or attend cultural events. With cultures that are different than our own, what we may need to do is obtain basic knowledge about different groups. And really, we recommend that you do this on the groups that you may be most likely to work with. You don't need to know everything about every different group out there. That's not possible. But you need to know the general facts about the culture groups that you're going to be working with. Know the key historical events that may have influenced other groups. know basic values and beliefs, and understand their cultural practices. You might have a knowledge of any dynamics of racism, oppression, discrimination, and stereotyping affecting the other group. And then once you have the awareness and have done your background work, then you need to learn behaviors and positive relationships with people from different backgrounds. Basically, learning interpersonal skills in a multicultural type way. A skill is the ability to do something well or to do something over and over with accuracy. Skills are developed through training, experience, and practice. So my phrase is always practice, practice, practice. There are concrete things that you can do to increase your multicultural competence with other groups, and perhaps listening to music, attending plays or other cultural events, reaching out and developing relationships with people from diverse backgrounds. Develop the ability to say, I don't know, and ask questions. Be curious. Travel to experience different cultures directly and develop a level of comfort discussing difficult issues. Within the substance use disorder population, there are some subcultures, if you will, and special populations that you need to be aware of if you're going into working with people with substance use disorders. Clients and spirituality. Forensics population, the criminal justice, and this may include antisocial personality disorders. Then there are the co-occurring disorders, COD, and basically here we're talking about concurrent integrated treatment of co-occurring disorders. You may hear the phrase SMI, which means those with serious or severe mental illness, and personality disorders are common in the co-occurring population, such as borderline personality disorder or the others. We're going to cover a few of these special populations within those that have substance use disorders in the next few slides. Religion and spirituality has traditionally played a larger role in addiction treatment, more so than in other areas of mental health or medicine. Treatment models were originally based, you may remember, in the 1930s on the 12 steps approach, and the 12 steps approach has demonstrated efficacy in well-controlled clinical trials, and the 12-step approach has worked for many. Asking a patient about their spiritual life can help to establish a therapeutic relationship. However, remember, exclusively promoting your own view of recovery and spirituality is disrespectful, and the therapeutic alliance may suffer. So again, go with where the client is at, ask them about their own spiritual beliefs, and then you can go forward with a discussion from the client's perspective, not from our perspective. The forensic population is very common in working with people with substance use disorders. So the counselor has to have a knowledge of the laws pertaining to coerced or mandated treatment of substance use disorder patients is very important in the practice of addiction treatment. So knowing what the possession laws are and the under the influence laws are and the different forensic type programs that a client may be in. Counselors who treat addicted persons may encounter many patients who lead lives marked by violence, trauma, and poor impulse control. Co-occurring disorders are individuals with mental health and substance use disorders. And so we're talking about that we should have this as an expectation, actually, of all clients that we work with, regardless of the setting. So if you are working with individuals at a homeless shelter, for example, you would expect that they have a co-occurring disorder. It is very, very common, and we need to begin acknowledging that substance use disorder coexists with mental health issues and or personality disorders. The co-occurring disorder patients represent the population with the poorest outcomes and the highest costs. So actually these patients should be prioritized for care. That care needs to be integrated. What do I mean by that? Treating both the mental illness and the substance use disorders at the same time by the same provider team in the same location is the evidence-based practice. So in the past, we would have clients, patients who again are the most fragile, the most vulnerable, the most perhaps disorganized, and we are having them go here for mental health treatment, here for substance use disorder, over here for maybe their physical concerns, and go and having to navigate transportation or walking around. That doesn't make any sense anymore. And so integrated care is the best practice, having everything in one location, treated by the same provider team, and at the same time they can get everything addressed all at once. Our ethical responsibility towards people with co-occurring disorders is to welcome them into treatment. And this means to communicate with individuals with complex, multiple disorders in a way that they understand that they are in the right place and that they made a good decision to show up and get help. There are some resources by SAMHSA. SAMHSA is the Substance Abuse and Mental Health Services Administration at www.samhsa.gov. They have a free resource called TIP 42 on substance abuse treatment for individuals with co-occurring disorders. SAMHSA is actually the one that has developed the evidence-based practice known as integrated dual disorder treatment. And those resources are free at that website. So if you're interested in particularly reading more about this population, go ahead and get those resources. Stigma literally means branding or labeling. This term connotes disgrace or diminishment of the person by virtue of some attribute or characteristic. Persons with serious substance use disorders often lack insight into their own disorders and are not fully aware of the havoc that addiction is wreaking on their health, families, careers, and community. Substance use disorders are highly stigmatized, even more so than mental health disorders. Addiction often involves illegal drugs and high-risk behaviors. Persons with SUD often have cognitive and emotional impairments, and then, like I say, they may not even have awareness into their own disorder. Counselors also may have internalized cultural biases and personal prejudices against or regarding addictions. Counselors, on the other hand, may also be in recovery themselves, so that they do have self-awareness. Frequent consultation and monitoring of boundaries, however, are needed. A really great local website that addresses this is Slow the Stigma, www.slothestigma, all one word, .com. They have some great materials and some recognition of stigma in our community. Advocacy. Counselors, you will have an obligation to the community. Participation in advocacy can take many forms, such as perhaps you're encouraging clients to register to vote. Speaking and writing and sharing our knowledge with others is an important part of our professional obligation. You may also choose to get involved in professional associations, whom we provide advocacy. Your professional organization of substance abuse counselors, they do advocacy, of course, for funding, for services, that kind of thing. You don't need to do it directly, but through your professional association. Make a difference and speak up for those who are not able to speak for themselves. Provide education, going to speaking at perhaps public hearings, and so forth on behalf of the clients that you work with. It's now time to complete the discussion forum, which is worth 10 points, and then complete the Week 5 quiz, which is worth 15 points. Be sure to do the required reading and the viewing of the videos prior to the quiz. Assignment number 2 on multicultural competence development is due March 17th, and this is going to be worth 25 points. If you're ready to begin to get started on that, it is listed in the module under assignment number 2 or in the Files menu on the left-hand side of the Canvas.